In the last few decades, there have been advances in medical technology that allows us to see with the naked eye the components that make up our physiology. But we can also see things that aren't supposed to be there. We see that something has to be done. And there are many ways to solve a problem. The surgeon knows this. The best solutions to a problem are found when studied by more than one set of eyes.
I prepare an operation by looking at the MR images and try to plan as thoroughly as possible what to do during the operation. MR is very good technology for looking at brain pathologies, especially brain tumours.
The MR technology provides images of what's inside the body without using any X-rays or cutting through the skin. The MR system consists of powerful static magnetic field, and using radio waves we obtain images of the anatomy and physiology of the object or tissue we are interested to study. Using a specific MR technique called MR spectroscopy, we obtain biochemical information of the tissue. And here we see a typical MR spectrum where we can see all the metabolites in the sample. This provides additional information that can be helpful for diagnosis and treatment of the disease. Our long-term objective is to improve and individualize cancer diagnosis and prognosis, but also treatment possibilities by developing clinically integrated MR methods and system biology.
Sometimes we not only look at the tumours, but also try to find exactly where different important structures in the brain are located.
If the neurosurgeon knows more about where the important brain areas are during surgery, he can avoid damaging them and prevent new neurological problems after surgery. When we do a functional MRI or fMRI examination, we take the patient inside the MRI scanner and we make him do specific tasks. If we want to map motor areas in the brain, we make him do movements with finger or tongue or toe. If we want to map language areas, we make him do language tasks inside the scanner. And what happens then is that blood with increased oxygen is flowing to these areas, and this is something we can detect with the MRI scanning. We can actually see the brain thinking. With the DTI or diffusion tensor imaging, we can map the big neural pathways in the white matter of the brain. It is based on that water molecules are diffusing along the neural pathways, and by mapping the neural pathways we can see how close they are to the tumour and whether the tumour is displacing the pathways or not. Through my research, I had a close collaboration with radiologists and neurosurgeons at the hospital and also technologists at SINTEF, and we made a new method to implement fMRI and DTI data during surgery so that they can use the information when operating on the tumour.
3D ultrasound is used when we have opened the skull, because you cannot use ultrasound through the skull. When we have opened the skull, we start with a 3D ultrasound acquisition. And based on these ultrasound images, it's possible to plan more in detail the operation.
Ultrasound technology is widely used in the field of medicine, and it's a pulse echo technique. So you have a transducer emitting sound which penetrates through the tissue, and part of the sound will be reflected back from organs. And these echoes, they are read by the transducer again, processed, and you can display them as images on the screen. In our research, we focus on developing technology for better patient treatment, for better image-guided surgery. Me as a technologist, I'm focusing on technological developments. It's a mix between work in the laboratory, in front of a computer, but also being present in the operating room. You're using the 3D ultrasound during the surgery to have updated images or updated maps. So when some tissue has been removed, you can acquire a new 3D ultrasound volume. Then the surgeon can use a navigation instrument and these images to guide the instruments to the correct position. 3D ultrasound offers safer and more precise surgery of brain tumors.
All these tools together allows us to see. Here we see the intricate relationship between the components, the two halves of the brain that exchange information. The parts cooperate and work as one. A surgeon and a technologist might view the world differently, but when they work together, they see better solutions and they know they get better results.
There is a long tradition in Trondheim for collaboration between clinicians and technologists.
There has been for many years a great development in medical technology here in Trondheim, and one of the bases for this development has been the close cooperation between engineers and surgeons. We always get ideas when working together and looking at the problems from different angles.
Our collaboration with the clinic is very important for us.
We save important areas of the brain. This is something we're constantly trying to develop new methods to improve.
I'm fascinated by the achievements in the past, but I'm also motivated by the challenges we have ahead, because I think our technology can be used to solve a lot of clinical challenges.